get her a biopsy another route. I think you have lung cancer. I don't think you don't have cancer. What happened is they wrote the report and they said lots of lymphocytes.
Gotcha.
And inflammation, non-diagnostic. And so when they read the report, they said,
Right.
so it's not diagnostic. It is encompassing the artery right there, and she's swelling in the neck because she can't get the,
Sure.
it's called SVC, superior vena cava syndrome, where the neck and head start. And do her eyes look swollen to you or not?
I don't think so.
Or her face at all? But that she's just having trouble getting that air because it's getting into the neck swollen.
Sure.
So it's not SVC syndrome, that superior vena cava syndrome yet. It's impending SVC syndrome, meaning so it's growing in here pretty much in one mass with a few satellite lesions. And it's very disappointing because he did 8 cores. First of all, your blood work is good. Your kidney, your sugar, everything is good. So that would be good to go. They did do an echocardiogram today, so that's, or it's ordered
for tomorrow.
so that's good, because that's always helpful treatment. I think it's lung cancer. I'm trying to get a bronchoscopy tomorrow because tomorrow's Thursday. And so I'm talking to 4 different pulmonologists to figure out who's going to be able to do that. And if they can't do it tomorrow, I need to know it's gonna be Friday.
Right.
And if it's not gonna be Friday, I'm sending you out. Okay, because if it's not Friday, then it's Sunday, Monday.
That's what happens.
Yes, and I'm not gonna do that. So if I do have to send her out, you live in Cincinnati, do you want her to go south to Columbus?
We've had the best luck in Columbus.
She's known to OSU, not for a
Right,
while, but
right.
she is known to there. Would you prefer, and hopefully I can get it done here. I just always
Yeah.
plan B.
If we need to go to Columbus, I'll come up and drive them down there.
Now, they will not let her go by private car, that she'll have to go by ambulance, I
Oh,
think.
oh,
With the oxygen. and
I
everything.
gotcha.
What about-
Well, Toledo we could, but then he's in Cincinnati.
well, I'm all right with the drive. That's fine with me.
Toledo is
Yeah.
closer.
Yeah, so let's do Toledo then. Yeah.
Let me call the hospice. I'm still waiting back to hear, they're checking back and forth with the OR and things like that. And so I've got 4 guys and they're all just looking around. And then there was apparently something on the schedule today with something. And so, but I can't accept Monday. They told me Monday maybe. And I'm like, no, that's not good. That's not gonna work. Because you don't understand that you're in trouble with your breathing more than you understand.
Probably.
Because
Getting worse,
you're
yeah.
stridorous, and I think you're sitting up to bring your trachea forward. See how she's perched forward?
Yeah.
And so she's stable right now, but 5 days, there's no way I would let you sit 5 days. Now, if somebody could hand me an envelope, say, there's 2 types of lung cancer. There's small cell, which is faster growing, which I think you have, and then there's non-small cell. Now, the thing about small cell, it does grow fast, and it does cause weight loss, and it is central, and yours is central, but it shrinks super fast. So even if you don't ultimately cure it, which we might not be able to do, if you could hand me an envelope and say, it had the biopsies come back, and Dr. Sevilla is so skilled. I think there was just a lot of inflammation around it because he got 8 cores, and I'm sure he's not happy that they couldn't get a diagnosis out of 8 cores. But, so they're gonna have to go in like a colonoscopy, they put you under sedation, they put you down, they go down the nose tube, and it's just right there, and all they need to do is pinch in there, and if we could do it tomorrow, oh, here's Don Valley. I looked at the images CAT scan, and I spoke with it, the 2 are talking, so that's good. And then now it's, when you have an iPhone, you can tell when somebody's taking.
Oh, yeah.
I'm just waiting to hear back if I'm credentialed. Perfect, works.
How advanced is it?
It's a very large mass, and we don't, so small cell only has 2 stages because it grows fast. It's the only cancer that has 2 stages only, not 4. Either meaning limited to 1 radiation port or extensive, meaning somewhere else in the body. but she's in respiratory compromise. So normally you would get a brain MRI, can't do that. I could never send her into a brain MRI right
Yeah.
now. We've got to treat thin stage.
Yes.
So I'm gonna get the radiation doctors on board. So if I knew it was small cell, which is what I think it is, I would get the chemo up and organized. It's really hard to give chemo at this hospital at night, but we would have it ready for morning
Sure.
to give it. And we would have her going over to the radiation center to get set up and do a few doses. And people go from breathing, they come in like this when they're got small cell. And then we treat them 3 days in a row, Wednesday, Thursday, Friday, or Monday, Tuesday, whatever. And this is a typical small cell person. And then they come in on Friday and they go, "What'd you give me, doc?" What was that? That really worked. So the typical treatment is cisplatin VP16. You've got wonderful kidney function. Sometimes we switch cisplatin to carbo when people are older, but you've got very good kidney function. My only question is, from your Taxol, from before, very long ago, do you have any residual, meaning leftover neuropathy in your fingers and toes? You do not. Good. Because Taxol, which she had before, is known for the tingling in the fingers and toes. And cisplatin, which is the best drug, which I'd like to use, so it's 3 days. And I wrote in my note that I would give it here in the hospital. Normally I would treat you as an outpatient. If you had walked in, even today, looking like that, and if I could start you today, I wouldn't admit you. I would treat you as an outpatient. But I don't have a diagnosis, and I have to have a diagnosis of malignancy to give you chemo and radiation. But they're working on it, and the man who's available is credentialed, but they have to sign. The
Sure.
big cheese has to sign off on it. He actually texted me last night, "Send me anybody," so that's what I called. He's great. He's from Toledo.
How soon will we have that?
He said, "I'll know soon."
Good.
She's either gonna have a time for Thursday or Friday, or you're going out tonight, if I can get a bed.
Right.
But if you had walked in looking like you do right now, I wouldn't have put you in the hospital. I would have sat you right in my chemo chair because I can get it quicker. I would have sent you right to my radiation front that's that far away. We would have beamed you up and you had your first radiation today. And we would have treated you Wednesday, Thursday, Friday, and we could have avoided a hospitalization. But now I'm looking at a weekend. There's no chemo on the weekend or radiation. And so I
Should be here during the weekend then.
can't say yet till I know where I'm gonna get it. But if I could get a bronch tomorrow, I would try to do both. I would try to get the bronch and the radiation, all three, and the chemo going tomorrow. But I have to.
But if it's Toledo, she'll go out tomorrow to Toledo then.
No, she could if they have a bed go out tonight,
Oh.
because we wouldn't wait, because then you're settled and then they can do it there
Gotcha.
tomorrow. If we wait to transfer her tomorrow, then you're looking at Friday.
Gotcha.
So either one or the other, it's so sensitive to both chemo and radiation. And you can get chemo in the hospital over the weekend, you just can't get radiation on Saturday or Sunday. But, because you have to have a tech and a physicist and all that such, and you can't get radiation anywhere on the weekends, that's
I
just
didn't
how it
know
is.
that.
Not even Toledo, it's not.
Yeah.
But if we can get a diagnosis, we can get you through the weekend with chemo. You'll feel, if you had either chemo or radiation, you'd feel better. This is Dr. Lolly. Hi, friend. Okay. Who's she? Oh, I don't know that. Oh, friend of the pulmonary practice manager. You know, if I knew it was Friday, I would wanna keep her here, cause I think I can move faster than if we transfer her. We can definitely move faster. Well, I would move her out tonight, actually, if I didn't think I could get it Friday. I would move her tonight. I never mess around, so. If you think you can do it, I'd rather she stay here with us. And she's definitely an SVC, cause she's propping up enough and such, but she's not severe. She's more impending SVC. But maybe I could get radiation to get her over and simmer tomorrow, if that's a weekday. But I can't give chemo without a diagnosis, so. And let me ask a question, if they could send her tomorrow and you were gonna bronch her Friday, would you whine over 1 fraction of radiation to just give her some breathing room? Would that be okay? I didn't mean to use the word whine, but you know what I'm saying. So, cause you should still be able to get the diagnosis. If we sent her to radiation, yes, tomorrow and could get 1 fraction, and then you could bronch her on Friday, and then they could do, and then I could start the chemo on Friday, and then we could go from there. She's gonna get it faster with me for sure, cause I'm pushy.
I can tell.
So, now, if you can't do it, but would Satari, cause Chari doesn't do EBIS, does he? Yeah. Oh, so symptomatic if we do. I know, I understand that. And we'll keep her here tonight. Yeah, right, Donald. Can I give her some steroids, or are you on steroids right now?
They gave me some earlier.
They gave her some steroids.
I don't know exactly what.
Yeah. She's gonna be stable overnight, but she is definitely rapid attention. Okay, thanks. That would help, so. All right, okay, thanks. Bye-bye. Keep me posted. Bye-bye. He's a fabulous doctor, and he's just now leaving UTMC. This is all political, and he has a non-compete, so he's gonna come down here.
Oh, nice.
And I had been sending my patients up there, cause he's that good,
Right.
that couldn't quite get the level. So he's
Yeah.
like that next level. And so I've known him for a couple of years. So he just called me this morning and said, if you ever need me in Findlay, I'll come. That's what he said this morning.
Yeah.
So I'm gonna ask you one question, and I'm gonna call my radiation friend. And I hope the answer is yes. You have a mass in your trachea here. Your mass is in the right upper lobe. It's large. It's 7 centimeters. So that's big. Hand here.
Oh,
So that's big, and it's pinching, and you've got some lymph nodes here. And what's happened is it's encasing the artery, and then the artery can't get out. And so it's called SVC syndrome, superior vena cava syndrome. They're superior vena cava syndrome.
right.
And we do know that you smoked in the past. Small cells is restricted to people who've smoked in the past and or present. And this is considered one of the oncology emergency. And so sometimes the radiation doctors, because they don't care what kind of cancer it is, to radiate it. I care because there's different chemo. I was told it was lymphoma, so that's this chemo. If it's small cell, it's this chemo. If it's non-small, you see it. So it matters. I have to see a cancer cell. But if you say, I'm in distress, all the doctors, because all the pulmonologists have looked at your film, thinks this is cancer. You think Dr. Lutz and Mode think it's cancer. And they'll say, Ellen, can we go ahead and beam you 1 dose before your bronch on Friday? I would say absolutely yes, because you heard me ask if he would whine if I didn't know what word to use. If I treat you on Thursday, if he comes in Friday, because I work with him, but I've never worked with him on an emergency like this, because he's new in this hospital, but I've known him for a couple of years. But if we could get radiation tomorrow and a bronch Friday, and radiation on Friday, and chemo on Friday, we'd be sitting really pretty and not wasting Thursday. Because the first radiation is the longest, because they have to get you up and around. And the problem is, and he says, I agree it's cancer. That's what Dr. Mbali says. I agree it's cancer. So I'm gonna send.
So the question is, are you willing to do that? Is that what you, yeah.
You have to be willing to be treated without a pathological diagnosis.
That's fine.
And I know that Dr. Lutz will do this with,
I'm 77 years old, you gotta do what you gotta do.
I would not want to not do that.
No.
Is there any hereditary aspect to it?
No.
Because her dad died of lung cancer.
This would
No, he died of a heart attack.
This would be.
Really?
I had to get the papers out and show Bob.
But he was laying on the couch coughing in, I thought he had lung cancer.
He did,
Oh.
but they
There's that.
removed part of it, but he died of a heart, he swelled up, he died of a heart attack. But he worked in coal yard and
This one, if it's small cell that. Hi friend, do you mind if I call you from our patient's room up here? 77, I just sent a picture of her. I did send her a picture, delightful lady, and then her son who lives in Cincinnati is right here. And she has a huge right upper lung mass that was found the day before Thanksgiving and sent to the family doctor. CT biopsy was ordered, done last Wednesday by Dr. Savella. 8 cores, non-diagnostic, believe it or not. So it says lots of lymphocytes. So I got called back to the hospital tonight for a lymphoma, but it's a non-diagnostic, and this is impending superior vena cava, no doubt. That's worsening by the day. And I've got Dr. Mbale. Do you know him from UTMC? You may not know this, I didn't know until today. He just left UTMC and he's coming to Findlay to set out his non-compete.
I had heard that was gonna happen, yep.
Oh, then you're one step ahead of me. So this morning he sent me a text, if you need me, call me. So I did. So his credential needs one more signature. He doesn't know if he can do it today, but he promises by Friday.
Okay.
So my question is, he says, and I sent you that, this is cancer. And so did Chari, and so did Sartari. So they all think it's cancer. I think it's cancer. The son who's here and the patient are willing to do radiation without biopsy. If it can't be done till Friday, can I send her to the center to get one radiation tomorrow?
That's easy, that should be easy.
Because then you could get Thursday and Friday in, because you could do tomorrow anytime you want. And then if he broncs her Friday, you could work around, because your sim would take longer. So could we plan on her doing that tomorrow then?
And I'm trying to, I actually looked at the schedule before I left. And
That's the best, because I don't want to send her out of town, because we'll have to wait for beds and all that stuff. So, and so my plan then is for you to radiate, and I even asked on Bali, didn't I? I said, the word I used, I shouldn't have used it, was whine. I said, will you whine if I get a radiation dose on Thursday and you bronch on Friday? And he said, no, do whatever you need to do. So he's on board with that.
honestly, from preventing a major potential catastrophe.
Well, I told her it's an oncological emergency, and she doesn't understand the distress she's in, because she's sitting bolt right, but then at the familiar 45-degree angle that we see. You know what I mean? So I told her that's how my small cells come in. And I told her, had she walked in my office today, I wouldn't have even admitted her if I didn't know it was small cell. I would have just sent her to you and then sent her to chemo, and wouldn't have had to admit her, because it goes away that quick. So, but now that we're looking at the weekend, I'll probably have to give her chemo here over the weekend for cycle 1. But I explained to her that you don't have to wait, but I do for tissue.
It's easy for us because it's more likely one thing, but even if it's the other, helpful either way.
Yeah. So I will get in touch with Stephanie at 7 and tell the nurses, and that is a wonderful plan. I am so much happier than that, because I was talking to her about Columbus or Toledo right now. So,
The way things have been going in terms of them being busy, it could have been so long.
and she's lost 50 pounds, but she's in really good shape. I sent you her picture, and she's very vibrant. She gardens a lot, she says. So this is a wonderful plan. Okay, thanks. Bye-bye.
So Friday will be a big, well, she'll get tomorrow with
Radiation.
and then Friday will be a big day with all that stuff.
What is today?
Wednesday.
Wednesday.
So the
Wednesday.
cart before the horse, what's the long term? Is it just regular chemo? Is it radiation? Is it?
It's radiation. Usually, if it's not the SVC syndrome presentation, you stage, get the MRI of the brain, you get a PET scan, look all over the body. We can't do that right now. So usually you do 2 cycles of chemo first, shrink it down, then you bring in radiation therapy on cycle 3. But with her, they're gonna have to give her, so they'll give her Thursday and Friday. She'll feel better on her way back
Gotcha.
from radiation. We need to get you hooked up to some fluids. No, because this is a ton of tumor. It has rapid lysis. It has to come out through the kidneys. So I gotta
Oh,
hydrate
yeah.
her up. Because you got good kidney function, but I'm gonna get you hooked up to an IV tonight. And then radiation tomorrow. I'm going
How
to.
long does that take?
Radiation, you should probably be there, it takes 10 minutes,
Oh.
but you will be there over 1 or 2 hours. So I just want you to talk to me for just a second. So what I want you to do is say the ABCs.
A, B, C, D, E, F, G, H, I, J, K, L, M, N, O, P.
That's good.
I'm running out.
So after tomorrow, she'll be released, and then we bring her back, or no? You're gonna keep her in.
She's gotta stay
Okay.
until we got a diagnosis, otherwise we can't push.
So that could be through the weekend then.
Yes,
Yeah.
she will be here through the weekend, so
Okay.
she'll get radiation tomorrow, go to see, and I will be over there because my office is, so,
They sent me there when they pulled the